Good evening, everyone. Good to see you. The American Diabetes Association welcomes you to our annual virtual Safe at School Parent Back to School Workshop. We're so glad you're here. I'm Crystal Woodward, Managing Director of Legal Advocacy and Safe at School campaign for the American Diabetes Association. First, I want to let you know that we are recording this session, and a link to this session will soon be made available on the association's website, and we'll also post a message on social media to let you all know that the link has been posted on the website. This evening's program will provide an overview of Safe at School. We will cover federal and state legal protections for students with diabetes. We'll talk about essential written plans and the components of those written plans. Plans like the Diabetes Medical Management Plan, or the DMMP, and a Section 504 plan. And then we will talk a little bit about the association's very comprehensive Safe at School resources that will help you to prepare to send your child with diabetes back to school. After the presentation, there will be time for questions and answers, so we'll use the chat box function. If you would please type your questions into the chat box. And also, we will do our best to answer your questions in the chat box during the actual program. But if we don't get to all the questions during the program, we will have time at the end of the program to answer the questions. This evening, it's with great pleasure that I'm co-presenting our program with ADA Safe at School volunteer extraordinaire Joyce Bowden. Joyce, thank you so much for joining us to share your insight, your experience with our attendees. Joyce is also the parent of a daughter with type 1 diabetes. And Joyce, would you mind taking a few moments right now to tell everyone a little bit more about your background, about why you are an ADA volunteer, and why this program in Safe at School is important to you?
Absolutely. Thank you, Crystal. Good evening, everyone. As Crystal mentioned, my name is Joyce Bowden. I live near Orlando, Florida, in Apopka, Florida. And my daughter was diagnosed when she was 4 years old. She will be 20 years old next week. So we have lived with this disease as a family for a number of years. I'm very passionate about teaching our children to advocate for themselves, but more importantly, having parents advocate on their behalf. And I'm a volunteer and passionate about this topic because I experienced the discrimination and wasn't aware of what her rights were. And so being educated is very powerful, and the ADA was very instrumental in assisting me during a very challenging time. And so I give back by educating others on this topic, because the ADA Safe at School campaign is very, very beneficial to all parents. And so I'm excited to be here with you tonight to co-present, Crystal.
Thank you so much, Joyce. Next slide, please, Abby. As I mentioned before, this session is being recorded by the American Diabetes Association and will be made available online for public access and viewing. And this means that the questions and comments that you type into the chat box will be part of the recording. While the ADA attempts to make sure all the information we're giving is accurate and current, this is general information. The information that we are conveying tonight does not constitute medical or legal advice. And should you need medical or legal advice, we recommend that you consult with a licensed healthcare professional or an attorney. So at the American Diabetes Association, our mission is to prevent and cure diabetes and improve the lives of all people affected by diabetes. And this includes children and youth who are students and enrolled in daycare, enrolled in preschool, and even college students or post-secondary students. And we deliver our mission through research, information and support and education, advocacy, and public awareness. Tonight, our program is going to focus on advocacy, and in particular, advocating on behalf of students with diabetes to make sure their diabetes needs are appropriately met at school. And really to talk about all that the ADA's award-winning Safe at School campaign does to help to make sure that our children are indeed safe at school. And now I'm going to turn the next segment of this program over to Joyce.
Okay, thanks, Crystal. We'll dive right into the Safe at School principles. The ADA's Safe at School campaign is based on 3 principles regarding diabetes management at school. And these 3 principles are that all school staff members need to have a basic knowledge of diabetes and know who to contact for help. At a minimum, everyone who has a custodial responsibility for the child should understand diabetes. Second, the school nurse is the primary provider of diabetes care, but other school personnel must also be trained to perform the diabetes care tasks when the school nurse is not always present. And third, the students should be permitted to provide self-care whenever they are at school or school-related activities. So this applies to students who possess the maturity level and skill to be able to provide self-care. They should be able to provide that self-care at school. Next slide. These Safe at School principles that I just described are supported by the organizations, many organizations, a very reputable organization. And this slide shows all of those organizations that believe in the principles that foster a safe environment for children with diabetes at school. Next slide. Okay, so as parents of children with diabetes, here's what we know. We know that diabetes doesn't take a break. It is 24/7 and care is required 24 hours, 7 days a week. We know that our children cannot take a break from diabetes at all. It is also very important that there's a smooth transition from home to school or childcare, that is very critical, and that we understand what that transition means and how important it is for the child. So for example, you may change your child's pump site at home, but the staff can elect to use a backup plan such as an insulin pen instead of changing a pump site in case the pump malfunctions. So you may be able to make treatment decisions based on the CGM data, continuous glucose monitor, if your child has one, but the school staff may use the data. They may not be expected to respond to every data input that you would, or data point that you would respond to as a parent. So we know that there are differences between how you manage at home and how the school is expected to manage. We also know that the child must have access to equipment, medication, assistance when needed. Parents and guardians have to make sure that the school has all of the supplies to provide that assistance to the child with diabetes. We also know that fluctuating glucose or out of range glucose levels may negatively impact learning and behavior. We know our children, and we know that sometimes a hypo can manifest itself in a very different way from one child to the next. Just like having a high or elevated blood glucose level they may have certain behaviors that show up with the high blood glucose levels. And written plans that we're going to talk about a little bit later are very essential for the kids as well. Next slide. So the goals for safety and inclusion for our kids at school. So we know it's important for students to have their diabetes management needs met to keep them safe and healthy while they're at school. So here are a few goals for diabetes care while they're at school. So the school must provide a medically safe environment for students with diabetes. Students with diabetes must have the same access to educational opportunities and school-related activities as their peers, and that the school must work with the parents or guardian and the child to reasonably support daily diabetes management activities while they're at school and in after school or school-related activities. Next slide. So this slide illustrates the key stakeholders that are quite a few stakeholders that are key in making sure the needs of students with diabetes are met and that they're treated fairly in the school setting. As you can see, it takes a village. It takes a lot of key partners and stakeholders to ensure that our kids are safe at school, including bus drivers, including the PTAs, including coaches and athletic trainers, all have a key role and are very, very instrumental in making sure that the children are safe at school. Next slide. So we're going to move on to the key strategies that we can employ to make sure that our kids are safe at school, including partnering with all of those stakeholders that we just talked about on the previous slide. So parents and guardians of the kids with diabetes have a lot of extra work that we need to do to assist those stakeholders in being successful and making sure kids are safe. So first, engage in a spirit of cooperation and partnership and work with the staff. So approach the school being willing to learn, being willing to educate. Be realistic and reasonable, recognizing that the school has protocols and policies that they must follow, just as you are passionate about keeping your kids safe at school. Being realistic is very, very key. I mean, we're only human, but we have to remember that all perspectives have to be appreciated and respected. Cannot emphasize how important communication is. It is definitely paramount in making sure that our children are safe at school. As you recall, there are so many stakeholders, so making sure everyone's on the same page and has the same information and are communicating with each other and with the child as well as with you all as parents or guardians is very, very key. As parents, we're required to provide supplies, snacks, quick-acting forms of glucose to the school so that they have all of that on hand. So being very strategic about ensuring that whoever your child is with has everything they need to provide the care that's expected. Providing updated contact information is critical as well, and working with the entire diabetes care team to develop the right plan for your child to make sure that the staff is prepared for success, and that's through training and support. Okay. So I'm going to turn it over to Crystal now to for the next section.
Thanks so much, Joyce. So we use the word discrimination. So what is discrimination? Discrimination is when schools or another entity do not provide access to persons with disabilities. So diabetes is a disability. And when schools do not provide a school nurse or trained personnel to assist and provide care to our students, that is discrimination because our children cannot safely access the school environment. So what does that look like? What forms does that come in? When parents are required to come to school to give insulin or provide other diabetes care, that's discrimination. The schools are required to have a nurse and or trained non-clinical staff who can provide care to our children. And we as parents should not be required to come to school to provide that care. When schools don't have a school nurse, they don't have trained non-clinical staff members, then the child is not able to get the care needed, and that's discrimination. Students who are told they cannot go on field trips or participate in other activities unless a parent comes along, constitutes discrimination. Student athletes not being able to safely participate in sports, not being able to go on the bus as a player to play in varsity football games because the school fails to provide a school nurse or another trained school staff member who can provide care for that child. That's discrimination. Students who are denied smartphone or smart device access to manage their diabetes while at school, that is also discrimination. And students who are denied the opportunity to take an academic test at an alternate time if blood glucose levels are high or low or out of range, that is discrimination. So these are just a few examples. There are other ways that schools discriminate against students with diabetes, but these are some of the more frequent situations we hear about. So we're going to talk just briefly about legal protections for students with diabetes. I really encourage you after this webinar to go to ADA's website at diabetes.org/safe@school to read more about the laws that protect students with diabetes in the school setting. There's just all kinds of great information that explains the laws. There's a bunch of great resources, helpful tools. We'll talk a little bit more about this later. But it's really important that you have an understanding of relevant federal and state laws that do provide legal protections to our students with diabetes. And it's important that you understand the obligations of schools to provide appropriate diabetes care to students and to make sure that they are treated fairly, which is what these laws require. So the main federal laws that protect students with disabilities, including diabetes, are the Americans with Disabilities Act, sometimes referred to as ADA, Section 504 of the Rehabilitation Act of 1973, or Section 504, and the Individuals with Disabilities in Education Act, or IDEA or IDEA. Also, in addition to federal laws, there are state laws and regulations and guidelines that, again, you can find all the information on our website, but just know that these laws can help level the playing field for students with diabetes and go a long way to ensure a safe and fair school environment for our kids. So the Americans with Disabilities Act, or ADA, it applies to schools, childcare programs operated by the state or local government or conducted on public school grounds, such as after-school programs. That is, Title I applies to state and local government entities. Title III of ADA applies to what's called places of public accommodation. And these are defined as businesses that are generally open to the public. And they're basically 12 categories. I'm not going to go into all of these, but just know that these categories include daycares, camps, community settings, nursing homes, senior citizen centers. Just know that all the programs that are open to the public have obligations under the Americans with Disabilities Act. So what does the Americans with Disabilities Act require? Well, it prohibits discrimination on the basis of disability. And as I mentioned before, diabetes is a disability because it is a physical impairment that substantially limits a major life activity. And I know that's a mouthful. Again, you can go back and read about it on ADA's website, But basically the definition of disability is a physical or mental impairment that substantially limits a major life activity. These activities are listed here, and take note that one of the major life activities is endocrine function. So many students with diabetes are protected under ADA. And ADA also requires entities to make reasonable accommodations and policies or practices just to make sure that the person with the disability has meaningful and equal access to all programs, services, and activities. So Section 504 of the Rehabilitation Act of 1973, under this federal law, public and private schools receiving federal funds have obligations to provide services to students with disabilities, including diabetes, including religious operated schools receiving government funding. So that's very important for you to know. Section 504 can also create obligation for childcare settings where the child care provider receives federal funding. The rules of 504 are very similar to those rules of the Americans with Disabilities Act. And for children who qualify for services under Section 504, the Section 504 plan is developed by a 504 team. And I should say that plan, which Joyce will talk a little bit more about in a few minutes, but that plan is individually developed for the individual students. There is no one size fits all for every student. And then the last federal law I'm going to talk about is the Individuals with Disabilities Education Act. It is a special education law, and under this law, it must be demonstrated that diabetes or another disability adversely impacts the student's ability to learn and to make academic progress. Also, if the diabetes in and of itself significantly impacts your child's ability to learn, your child may also qualify for services under this law. If your child is eligible for services under this law, what's called an individualized education program or an IEP would be developed by that 504 IDEA team and put in place for your child. And that IEP would include diabetes provisions that are normally included in a 504 plan. So you don't need both. If your child's eligible for an IEP, they'll have an IEP, not a 504. So what are some of the common reasonable modifications for students with diabetes that as parents, we want to make sure are incorporated in that Section 504 plan, IEP? Well, these are just some examples of what the law requires in the context of schools, designating and training school staff to provide care, including bus drivers. So we know that not every school, unfortunately, not every school has a full-time school nurse. And even in those schools who are lucky enough to have a full-time school nurse, the full-time school nurse cannot be in all places at all times. But the more common scenario is that schools will have a part-time nurse that will be shared amongst multiple schools. So we want to make sure in that 504 plan that we're writing in a provision that training will occur, the training of school staff will occur, and appropriate care will be provided to your child in accordance with your child's diabetes medical management plan or provider's orders. We want to write in that there needs to be monitoring of blood glucose levels and responding to levels that are out of range. We want to write in which staff member is going to actually help your child to administer insulin, Or who's going to administer insulin if your child is younger and does not self-manage, so can't do the insulin administration independently. Also, if your child needs help with counting carbohydrates, that should be written into the plan. And administering glucagon in the event of a hypoglycemic emergency, of course, should be written into the plan. Again, these are just a few examples. There are so many more. There's a sample plan on ADA's website that you could take a look and see what we've gotten there. But these are just a few examples. Next. So in addition to federal laws, there are state laws and regulations, but just know that while all schools must comply with federal laws, the ones I just spoke about, that there are certainly state law considerations. All of our states have what's called Nurse Practice Acts and other laws and regulations that speak to who may and or may not provide care to students with diabetes. So there are some states that do not permit school nurses to delegate care, such as insulin administration. And it's important to know what the laws say in your state. And you can also find out what those laws are and what they say about the delegation of care on ADA's website. Often there's no statewide policy, and rather policy is determined district by district, and actually sometimes even schools within the same school district may have different policy. Some states have developed school diabetes management guidelines. Those can be found on our website. You know, guidelines about training, guidelines about how emergencies are handled, guidelines for protocols on field trips. So look to see if your state has guidelines. Some states have passed school or child care diabetes care legislation or changed Board of Nursing regulations. As a result of ADA's leading efforts in the legislative arena, we actually now have 35 states, including the District of Columbia, that permit trained non-clinical school staff to give insulin and glucagon. And this is quite significant because, as I mentioned before, not all schools have a full-time school nurse. So it's important that a backup plan be put in place. And that backup plan is, part of the backup plan is training unlicensed personnel. Again, regardless of state and local laws, the requirements of federal law must be met. And to learn more about federal laws and your state's laws with regards to the provision of school diabetes care, you can go to diabetes.org/fedlaws. And I encourage you to do so. We just want to mention a recent ADA success that benefits not only New York City public school students, but also serves as a model for school districts nationwide. Back in November of 2018, the association, along with 3 New York City public school families, filed a complaint with U.S. federal court against the New York City Department of Education and Office of School Health and other defendants. And what the challenges were basically were the city's failure to have an efficient and timely process in place for Section 504. Also, part of the challenges were that kids weren't going on field trips because if the parent couldn't go along, in many instances, the school nurse couldn't go along on the field trip. So sometimes the kids would have to stay behind or a field trip would get canceled. Also, the training in New York City of school staff and others was not as robust as it probably should have been. So as a result of a settlement agreement and a court order, couple court orders that required now for the city to put a 504 process in place so that students with diabetes have a 504 plan from day one of the first day of school. It includes a robust training of school nurses, staff, and bus drivers. Bus drivers and bus attendants are now required to be trained to recognize hypoglycemia and to give glucagon to New York City public schools students experiencing a hypoglycemic emergency. And also the lawsuit provided for a pool of contract nurses to be established to go on field trips and to attend other events so that students with diabetes would always have someone who had been trained to meet their diabetes needs. And then as part of this lawsuit, a 3-year monitoring period was established just to see how things are going in New York City public schools. Again, this is for New York City public school students, but it certainly is just a very strong model for school districts nationwide to take a look at, to maybe adjust their policies, maybe take a look at their training, take a look at their 504 processes, and to see how they might improve for their students with diabetes. And now I'm going to turn the program back over to Joyce, who she's going to talk about written plans.
Okay, so written plans are very, very, very important. So following the path of this presentation, once you're educated on the laws and understand your rights and the obligations that the school have, it's very critical to make sure that that lands in a document somewhere. So this slide details the 5 plans, the plans that schools commonly use to document and support delivery of care to the students with diabetes. So the first one that's listed is the DMMP, that's the Diabetes Medical Management Plan. That's commonly referred to as the doctor's orders. So this details what, right? It tells what the care is required to, what needs to be done to manage the diabetes. So the DMMP is written by the healthcare team with input from the student and from the parent. It's also signed by the healthcare provider. So this is what needs to be done to manage the diabetes. The 504 plan and the IEP team. So these plans are educational plans. So the 504 plan is broader around accommodations that need to be developed under Section 504 of the Rehabilitation Act that Crystal mentioned earlier. So a 504 accommodation plan documents the reasonable accommodation to support the academic process and ensure equal opportunity. So this is written by the 504 team. So there are lots of contributors to the 504 plan. That team includes the student, the family, the school nurse, teachers, and the administrators. An individualized educational program, or the IEP, is required for students who receive special education or related services under the Individuals with Disabilities Education Act, or the IDEA. So an IEP includes a section on health. So, but it is a comprehensive document that addresses all areas of a student's education and related service needs. So this is written by the IEP team, which includes special educators or general educators and related service professionals, the administrator, the parents, guardians, and the students. So either a Section 504 plan or an IEP may include implementation details from the DMMP or the doctor's orders that either duplicates or replaces what's in the IHP, which is the next one, the individual health care plan. So the individual health care plan documents how the medical management as specified in the doctor's orders will be implemented within the school. So the DMMP tells you what needs to be done. The IEP says, here's how we agree to carry out the doctor's orders. So it translates the DMMP into a plan that works in the context of a particular school building or program. It identifies all of the details of who's going to do what, when, and where, and how related to diabetes care tasks. The IHP is written by the school nurse, but is developed with input from the school health team, including the student, the family, the school nurse, and other school staff. So as we mentioned earlier, it takes a lot of partners to contribute to the safety of our children at school. They all contribute to making sure that these written plans are in place and how the care will be administered. So there's also the quick reference guide. So there are 2 quick reference plans provided in the ADA school guide. These plans provide information on how to recognize and to treat hypoglycemia and hyperglycemia. Next slide. So we'll talk about these individual plans in a little bit more detail next. So the DMMP, again, is the doctor's order. So there's a new ADA DMMP for the 22-23 school year on the ADA website. So definitely visit diabetes.org/DMMP to download the new DMMP. Many states have their own versions of what this document looks like, but this is the one that is a great sample document. Some school districts have their own. So again, you can check with your school district, but no matter which plan your child uses, you should make sure that all aspects of diabetes care is addressed there. Next slide. Forgot to mention there's a child care DMMP as well. So the diabetes medical management plan is really, again, the doctor's orders, and it is individualized by your child or his or her provider, and they serve as the foundation for the development of the child's accommodation plan. So you should not be handed a DMMP that is, a copy of someone else's. It really is individualized for your child, and it is prepared for by the provider anyway. So it is the comprehensive plan. It includes the level of supervision that the student requires, dosages of medication, how to manage hypo and hyperglycemia, and ketone management. So all of those details are in the doctor's orders. And it also may include some specific management instructions during field trips, unplanned activities such as school lockdowns and disasters. Diabetes management may be different with different levels of activity and different times of the day. So again, it's customized to your child's school, the building, how the building layout may impact the doctor's orders. The school schedule may have an impact, what should happen during a lockdown. All of that should be outlined in the DMMP. So here's on this slide, some main provisions or components of the DMMP. But again, be sure to check the ADA's website for some other provisions to consider. So having emergency contact information about CGM and blood glucose monitoring, glucagon administration in terms of dosage should be included as well. What should happen, perhaps before PE or before sports or after PE, how to recognize highs and lows. Insulin administration should be included in their meal and snack schedule, and level of self-care is very important, and that should be included in the DMMP as well. Next slide. Currently, the ADA Safe at School working group is involved in a research study to compile some stakeholder information, stakeholders being the healthcare providers, school nurses, and parents, looking for feedback and experiences using the ADA's DMMP sample form. So you can scan this QR code that's on the screen now, or go to the diabetes.org, again, DMMP, and take the survey to be able to provide some good input so that the research results and findings can be used to improve the DMMP support. Next slide. So the Section 504 plan, I think this is probably the most common one. A lot of questions around the 504 plan. So this approaching the 504 should be done, again, in the spirit of cooperation and collaboration with the school. Being proactive around the 504 plan is very, very important. So develop a plan even when things are going well. The purpose of the plan is to say, here's what we agree to, we being the parent and the school, on how we're going to provide the accommodations for the child to make sure the child is safe at school. So again, when things are going well, it's great. And when things aren't, it's great. That way it's documented and the staff will be all on the same page with what your expectations are as you as well with the school. As you all know, turnover is very real in the school system right now. So the staff that was there last year may not be there this year. So it's very important that the document lives on beyond the current administration. So accommodations should be reasonable, and it is safer for your child if everything is in writing and everyone understands their role. And so at the end of a school year is a great time to start talking about the 504 plan. And that plan should be revisited and updated whenever your child's DMMP or their regimen changes. The 504 plan should be updated as well. So a DMMP or healthcare plan is not a substitute for the 504 plan. IEP or other written accommodation plan. So again, this is the written accommodation that you and the school have agreed to. So it's definitely safer for your child if all of this is in writing. And again, you can find a template on the ADA website. Next slide. So here's some additional benefits of having a 504 or IEP plan. It clarifies everyone's roles and responsibilities and expectations, as I mentioned, between the school, the parent, and the other, because whoever will be engaging with the student at school. So it validates the health condition for the student and what the student needs to optimally function during school-related activities. It employs a formal legal process for determining how students' needs will be met and redress if needs are not met. So again, what accommodations legally are agreed upon and how those will be met. And it also provides students and parents with the comfort of knowing that the student will be safe and treated fairly because we have it here in writing. So it's very, very important for the school and family to work together to develop the individualized plan. The word I want to highlight here is individualized. So the 504 plan should be customized to your child and how your child's accommodations will be met. There may be multiple children with diabetes in the school, type 1 diabetes, but how your child's diabetes should be managed is individualized. So what works for one child or one student may not work for the other. Next slide. So navigating the 504 and IEP process. So there's some initial steps and some very important considerations when beginning the IEP or 504 process. So contacting the school administrator or the 504 coordinator, at the school is the very first step. So many times this is the school principal or guidance counselor, but your school will be able to tell you, point you in the right direction there. Requests should be confirmed in writing. All of the communication between you and the school as it relates to diabetes care should be confirmed in writing. In fact, it's a good idea to keep a written log of all of your communication with the school. The school might also, in some cases, initiate the process if a need or service for special education is observed or suspected by the school. Once eligibility has been determined, the 504 team will convene to develop the written plan. So some school districts may require an individual assessment to determine if a child is eligible for services under these laws. So for example, a formal assessment is required for an IEP to determine if the child is eligible. But with either plan, the 504 or IEP, a team will be convened to discuss the child's eligibility. So that once that's been established, then the team will convene along with you and the student to develop the written plan from that point on. So the 504 is one of the key pieces. I can't emphasize enough how important it is that it's very important to have that plan for all students with diabetes. Don't wait until there's a problem, but have the plan in place long before there are any issues. Next. So some frequently asked questions based on the things that we've just discussed. So what steps should be taken if the student is encountering diabetes management issues at school? First, educate the school on the relevant laws. Again, definitely take the time to go to the website and review those laws and the school's legal obligations. If a conversation doesn't work, then draft a letter explaining the child's rights. Another frequently asked question is, can a school say they do not have anyone trained on diabetes management and therefore refuse to enroll a student or send a student to another school? Training staff, in addition to school nurse, to provide diabetes care enables the child to safely access the school setting. So parents and guardians can be helpful in connecting the school nurse with pediatrics diabetes healthcare providers to conduct those trainings. And can a school refuse to allow a student with diabetes to go on a field trip if a parent or guardian does not come along? I think we hear this question every year, maybe 30 times a year. The answer to that is no. It is the school's legal obligation to provide a school nurse or trained non-clinical school staff member to provide care to the student during the field trip. A parent or guardian cannot be required to accompany the student as a condition of the student's participation on a field trip. Those are just 3 of the commonly asked questions. I will now turn it back over to Crystal, the last section.
Just wanted to review some of the excellent resources available to you for free on the American Diabetes Association's website. Please feel free to share these resources with other parents, with school nurses, with providers. And also don't forget that you yourself, you are a resource for the school. You know your child's diabetes the best. And also you have access to diabetes educators and your providers who could potentially help to train school nurses, to keep school nurses up to date on the latest diabetes technology and treatments. And the parent is a key resource in training the school nurse and other school personnel in your child's diabetes, that individualized training, your child's pump, training on what your child's lows look like. It's very individualized, and the parent plays a key role. Next slide, please. So these are just some of the ADA's resources that are available from our website. All the way to the right is our school guide. I call it the School Diabetes Care and Management Bible. This guide was published in late 2022, so it's still fairly new. And it was originally a guide produced by the National Diabetes Education Program, but now ADA produces it, and it was updated in 2022 by our Safe at School advisory group, who is a group of pediatric diabetes healthcare professionals from across the country. And then in the middle, we have our diabetes care task at school, what key personnel need to know. This curriculum is also available from our website. It consists of a number of PowerPoint slide decks that a school nurse or diabetes educator can use to train non-clinical school staff. There are notes on each slide. There are post quizzes for each module. And if your school nurse or diabetes educator is looking for a curriculum to teach unlicensed staff, here it is. It's all done for you. We also have our post-secondary guide. This is a comprehensive resource for students who are attending university colleges or other post-secondary institutions, as well as trade and vocational schools. It covers the 504, the Americans with Disabilities Act, and explains how to navigate the 504 system in that post-secondary environment. Please note that the plan developed at the secondary, post-secondary level, it's not always a 504. Many times the 504 takes the form of what's called letters of accommodation that are issued by the disability division of a college, university, or other post-secondary institution that the student can share with instructors to help educate and inform about diabetes and about what accommodations a student might need in that setting. So this guide and other related resources are available at diabetes.org/college rights. And all of our children do grow up, I assure you, and this guide will come in very, will be very helpful to you and your children. So this is a card, a little business card that the association recently produced in response to complaints we were hearing from parents that their children were being stopped or confronted at school, maybe in the hallway, about using their smartphones for diabetes management. So we thought it might be helpful for students to have, a little card they could carry with them, maybe have in their pocket, maybe slide and attach to their cell phone. That explains the reasons for why the student is using the cell phone. And it's also, as you can see, we included a signature line for authorization by a teacher, by a principal. We're interested in getting feedback on this. This particular resource, you can also download from our website and cut it out. So it's available directly from our website. Okay. So what are the key takeaways and tips for parents, guardians? Well, make sure your child's treatment plan, provider's orders, DMNP, make sure that it's current. And now is a good time, if you haven't already done it, it's a really good time right now to make an appointment with your child's diabetes provider and go in and get that DMNP filled out. The school year will be here, the beginning of it will be here before you know it. So I would do that right now. Make sure your school has trained staff available to provide needed care and assistance to your child. If there's not a full-time school nurse, do find out what the backup plan is. Who is going to be trained to provide care to your child in the event that a school nurse isn't available to do so? Again, be a resource for your school. You may be able to help your school nurse to identify trainers, to identify tools, resources, information, updates. So please be a resource for your school. Work with your school to develop your child's individualized written care plans, the 504, the IEP, or other written accommodations plan. You will find out that many times the development of the plan is a negotiation. It's not all set in stone. So just, I would have in your mind what provisions of those plans are negotiable, which ones are really important, what's non-negotiable. Provide current contact information. I know that sounds really simple, but one of the complaints and concerns we hear from school nurses is that sometimes, they go to reach out to a parent for, to have a question answered or to reach a parent in the event of an emergency, and the contact information is not current. And then last, provide the needed supplies, equipment, and food for your child. Okay. So a formula for the safe and healthy school year takes planning, work with your school to make sure that there is a plan in place. It takes education and training, communication, and teamwork. As Joyce said, it takes a village. It certainly does. And you are a team. You're a team with the school nurse, with your child's provider, with the teachers, with counselors, with administrators. So when you have all of these elements in place, your student will be best positioned for a safe and a healthy school year. Next slide. So next week, July 19th, 11 a.m. Eastern Time, 8 a.m. Pacific Time, the association will be hosting a back to school roundtable. Our panelists will be school nurses from across the country. So I encourage you to attend. I encourage you to share this information with your school nurses and your providers and to encourage them to attend. And just like tonight's program, next week's program will also be recorded and available at a later date for sharing. These are some of the links, but basically if you go on diabetes.org/safeatschool, you will find links to all of these resources and tools. And then last, if you need more information about what we have covered tonight, if you have a general question, if you have a specific situation at school that where you'd like to have some guidance from the association, please give us a call or send us an email. And a legal advocate will get back to you with guidance and information. We do not provide legal advice. We do not provide representation, but we will put you in the right direction on where you might go if you do feel like you need an attorney. But 1-800-DIABETES, so please just give us a call. Okay, so now that we've finished sharing our slide deck, it looks like we might have some questions in the chat box. And Abby, did you want to read those questions to us? And we will answer as many questions as time permits. Let's see where we are. We're actually at 7:59, but I think that we could spend at least another 5 minutes trying to answer some of these questions. Is that okay, Joyce?
Yes, that's perfect.
Okay, great.
Yeah, that works. Would you like me to read some of the ones that you've already answered in the chat? It doesn't look like we have any new ones yet.
Let's see. I'll look through them too. So many great questions, you all. Thanks so much. And I know that sending your child to school for the first time after diagnosis is scary, but trust me, Joyce has a daughter. I have a daughter with type 1 who was diagnosed when she was a year old, and she's now 33. The schools did a beautiful job, and the key is teamwork and working together and planning and education. And just, rest assured that the school will take care of your child. So we're always going to worry. I mean, even when our kids are adults, right, Joyce? Joyce and I were just talking about this the other night, just how we, our kids are adults.
Never stops.
Never stops. But just know with some training and education that your child's going to be just fine. Yes. Were there any more questions? I'm looking at myself. Oh, did we answer this one about if there are costs involved to get non-clinical staff trained, who's responsible to pay? That would be the responsibility of the school. Mm-hmm. The school would pay for the trainers. It's the school's obligation to have trained personnel.
Crystal, did you see the question around who to contact if the school is requiring them to come and administer insulin?
I did not see that one, but that's a great question. Yeah. So, I always say work your way up the chain of command. I would go to the school nurse first, go to the school nurse's supervisor. If that doesn't work, I would just keep elevating your concern. And please do give us a call at ADA because we have some information that is on point for that. Ultimately, if you're still running into barriers, you could even call your state's school nurse health consultant. Most of the states and within their state Department of Education agencies have a school health coordinator that can be very helpful with these types of situations. And also share our resources. I mean, our resources are for education and training, but they're also for negotiation. And that guide that I pointed out, Helping the Student with Diabetes Succeed, a guide for school personnel, that talks about the importance of having backup trained personnel to provide care. And it also talks about how a parent cannot be required to come to school to give insulin or provide diabetes care. The school is responsible to provide that care. Public schools, private schools, all schools. Sometimes where it might get a little bit sticky is if it's a religious school and a religious school not receiving federal funding. But even with those religious schools, most of the religious schools I'm familiar with, they do have an anti-discrimination policy. So they have a pledge not to discriminate. So I would recommend that you check that out, and if that's the case, and then show them how they're violating their own anti-discrimination policy by not providing care to your child. Mm-hmm. Let's see. Oh, if my child is sent home from school because she's having too many highs or lows, according to the nurse, this is part of discrimination. Yes, it is. Mm-hmm. It certainly is. And the blood glucose target range should be set out in that DMMP. And there should be also set out in the DMMP circumstances under which a parent should be contacted. But child certainly should not be sent home for every high and low because they're missing out on important educational time.
Right. I saw an earlier question right before that. What if no one is interested in being trained and someone is in a small school district and the parent isn't communicating well? I know I experienced that, and no one really wanting to be trained. And sometimes, as Crystal mentioned, it's simply education, helping to understand what that apprehension is and educate. Sometimes that's all you have to do. I had that scenario, and the person that finally raised their hand to be trained was the computer lab teacher, so it didn't matter who it was as long as someone that's willing to be trained. And so that really, in one year, it was the art teacher and she wasn't even my daughter's teacher. She was an art teacher who was willing to be trained. So sometimes you just have to keep asking and help uncover what the apprehension or underlying fear is.
That's excellent, Joy. Also, I don't know, it's rare for me to meet someone who doesn't have a family member or friend
Yes.
with diabetes.
Mhm.
So you might be surprised to learn that there are teachers at school who have children or relatives or other loved ones with diabetes, and they are more than willing to be trained. Usually the principals and the school administrators are trained in schools and states where that is allowed, which is most of the states. Let's see.
We received a question about where people can find the cell phone card.
Okay, it is, you can find it, I'll see if I can find the link, but if you go to the Safe at School page and you go to the right column and click on Help for Parents, the card should be right there.
And then another question we just received was, if the student goes to school and the blood glucose is dangerously high or low and interventions are not working to get the blood glucose to the target range, is it still considered discrimination when the nurse calls the parent to pick up the student?
Well, obviously, if something's not working, the parent would have to be notified. That I wouldn't necessarily say that's discrimination if there's a valid reason to pick up the student. And if the student continues to be low, that might be that's a concern. And I would recommend that the parent work with the provider, the child's provider, find out why that's happening and to make needed adjustments.
Yeah, agreed.
And maybe, are there any more questions?
Doesn't look like it. Someone just put in a comment. Well, no, we did just receive another one just now. Is it considered discrimination when the nurse doesn't agree with the doctor's orders or doesn't follow it?
Not necessarily. I mean, the school should follow the doctor's orders, but sometimes the nurses may have questions, and they're valid questions. So there's nothing wrong with the school or the nurse questioning the orders, but the nurse should get clarification from the provider so that we can make sure the child is receiving needed care.
And Crystal, this goes back to that communication, right? And making sure that everyone is communicating all along the way, and that the parent gives the okay, if you will, for the nurse feels comfortable calling the provider and getting clarification and keeping the parent in the loop and making sure everyone's on the same page, because sometimes the nurse does have questions, and to provide the best care, they need to get those answered.
And then we did receive another question too, and it's, in the current climate and schools needing to go into lockdown at times, unable to leave the room, if the student doesn't have a kit with them, is it the school's responsibility to provide low blood sugar supplies, snacks, juice in the classroom?
Yeah, this is a tough one, especially in today's environment. So, we're all just doing the best we can, including our teachers and school staff. ADA does have some guidance on this on the website, but our recommendation is basically to work with the school nurse in the school to figure out where these low kits should be kept, and who is going to be responsible for grabbing the low kit in the event of a lockdown. Certainly, they should be as close or with the student if possible, but it's not always clear cut, and the actual supplies in the kit should be provided by the parent. I'm not sure if that's part of the question, but the parent should be providing the low supplies.
Agreed.
Okay. I think we could wrap it up, Abby. So thanks again, everyone, for joining us this evening. Thank you for your great questions. I hope you found tonight's program helpful and informative. Just remember, you can call the ADA if you need more information. If you want guidance on a particular situation, call us at 1-800-DIABETES or email askada@diabetes.org. We also have just a wealth of resources and tools available on our website. Also, if you wouldn't mind, please encourage your school nurse to register for our program next week. I think it's going to be a really good one. And parents, providers, teachers, and others are certainly welcome to attend. And again, it's just another educational opportunity. Our registration is at diabetes.org/safe-at-school. Thanks again for attending this evening's program. Thank you, Joyce, for co-presenting this important program with me. Thank you, Abby, for all of your help. And on behalf of the American Diabetes Association, we wish everyone a very healthy and successful school year ahead. Thanks again for attending.
Thank you.